Hi everybody, I'm Marcus, and I'm going to give a wrap-up talking about out-of-hospital cardiac arrest in Singapore, and also try to link back to sports and heat-related issues. So this is the sort of like my disclosures. So I do work at Singapore General Hospital, but also advise MOH and SCDF on pre-hospital emergency care.
Hi, my name is Samantha and I'm a survivor of cardiac arrest. My episode happened in January of 2011. I was getting ready for work when I had a cardiac arrest. When I collapsed, my husband administered CPR on me and called 995 for an ambulance. And when the paramedics arrived, they were able to restart my heart with an AED. And today I'm leading a normal life, and I highly encourage everyone to learn CPR and how to operate an AED, because this would definitely save lives.
So Samantha was one of the first cardiac arrest victims that I managed at SGH. And at that time, she was only 22 years old. And only later we found out very strong family history of sudden cardiac death. The brother died at age 30 from sudden cardiac death. And she collapsed at home, was in what we call mega VF. So those of you who teach CPR, you know, is the mega VF scenario, right? So shock, then collapse again, shock, collapse again, shock, collapse again, 31 times. 31 times. And she walked out the hospital 3 days later. And that's because the husband started CPR immediately. And when the paramedics came, they actually gave the first shock. And resuscitation actually continued in the hospital, and we did things like therapeutic hypothermia, which is cooling the body, protecting the brain. So I always say that someone like Samantha, 20 years ago, probably the chance of survival is very low, less than 2%. Today, patients like her, if they have a cardiac arrest in Singapore, chance of survival is about 25 to 30%. So we have actually seen a 10-fold increase in our survival over the last 20 years. And not only that, I want to emphasize that they are surviving well. So just like our cardiac arrest survivor today, 8 out of 10 will actually recover with good brain function, go back to work, go back to their normal life, right? So our aim is not just to increase the number of survivors, but to make sure that they survive well, right? No point to survive and end up in a nursing home, end up disabled. And in order to do that, we want to promote something that we call the frame of survival. So what is the frame of survival? All of you are familiar with the chain of survival, right? Which you learn during your BCLS or your CPR, your first aid courses, right? So early bystander CPR, working the dispatcher 995, volunteer first responders, ambulance, EMS, hospital. But beyond that, there's something that we call the inner frame of survival. These are factors within our system that influence survival. For example, the quality of our education, quality of our training, the motivation of people, culture of excellence, technology, being able to use, for example, smart applications. And then there's something that we call the outer frame of survival, which are things beyond health and beyond healthcare, such as political commitment, support from society, the willingness of people to help others, right? And then your response time in terms of traffic, right? Communications and all that. So what I'm trying to say with this slide is that in order to save a life, it takes a whole system. The cardiologist can't do it alone. The emergency physician can't do it alone. The EMS, ambulance can't do it alone. It is all of you working together with us, citizens, lay responders, family members, government, policymakers, working together to save lives. And so one of that is actually using data to drive our practice and make improvements. And I'm going to share with you some of our data trends over the years. Now, you can see that there are a few very obvious trends. Number one, the number of people having cardiac arrest is still increasing every year, 5 to 10%. So when I first started collecting data 20 years ago, we had about 500 cases every year. Today, it is almost 4,000 cases every year. Why? Well, the population has grown, right? But also, we are getting older, And there is still an increasing burden of chronic disease. High blood pressure, diabetes, heart disease is still increasing in our population. And so you can see very obviously from here that the group that is above 65 is actually driving a lot of the increase, right, as we have aging population. The other thing that you will see is that we have improved a lot in terms of our response. So 10 years ago, our bystander CPR was about 20%. Today, if you have an out-of-hospital cardiac arrest, 60% of them will get bystander CPR. And that's a combination of what we call telephone CPR. That means if you call 995, the instructor or the dispatcher will give you instructions over the phone to start chest compressions. And then secondly, we actually have more training for the public, right? And thirdly, we are actually activating volunteers to go and start. The other one is bystander AED has also increased from less than 1% to more than 10%, right? 10 years ago, I asked you, find me the nearest AED in public. Cannot find, right? Today, go downstairs in the lobby, there's one, right? MRT, there's one. HDB block also, there's one. So this is a very good thing, and I'll show you the next generation is actually going to be even smaller, even lighter, even cheaper AEDs that you can carry on your person. Put in your backpack, bring to school, bring to work. Okay? Yeah, I'll show you some of that in a while. Okay, so down to the epidemiology, you can see that even when we adjust for age, so this is a technique that researchers use. We call this age adjustment. So aging population, you can see there's an increase in our cardiac arrest incidents. But even when you adjust, if Singapore's population was as young as it was 20 years ago, the incidence is still increasing. Okay, so this goes back to lifestyle, to risk factors, lack of exercise, too good food, too many hawker centers, right? And then I mentioned also that, you know, even among the less than 65, the incidence is increasing. Not as fast, but what is really driving it is those who are above 65. And the good news for the ladies here, if you're a lady, right, the men have 2 times higher risk of getting an out-of-hospital cardiac arrest. So I always tell the husbands, send your wife for CPR training. Now this one is a bit more sensitive, but if you look at it, there are significant differences between the ethnicity, right? So unfortunately, Indians and Malays actually have almost double the risk compared to the Chinese population. Okay, so again, this speaks to us about the need to engage culturally, ethnic, religious, appropriate kind of outreach and training, right? And so one of the things that my team at the Unit for Pre-Hospital Emergency Care has been doing is going into the temples, going to the mosques, trying to engage the at-risk populations. So if you think about it, if you are a CPR training center and you're waiting for people to come to you, only those who are interested in training will come to you. But those who actually need it, the communities that really need it, they won't come. So mountain don't come to Muhammad, Muhammad must go to the mountain, right? Yeah, so I will encourage you to think about your outreach. Who are the at-risk populations and how can we reach them? And unfortunately, Mr. Chua has gone back, but there are also differences depending on which district you stay, where you live, and how on your MP is on CPR training in the community, okay? Because there are, of course, differences in terms of the aging population in the different districts, right? You know that certain HDB estates have a much older population, other estates have much younger population, and later I'll show you there's also difference in the survival rates depending on where you stay, okay? Okay, some other good news is that we have actually had a very successful dispatcher-assisted CPR program. So today, if you call 995, they will ask you 2 questions, right? Is the patient conscious? Are they breathing normally? Okay, and remember, breathing normally is important because agonal breathing is not breathing, right? And if it's no, we practice what we call go. That means they will tell you, start putting your hands on the chest, start chest compressions. And by doing that over the years, you can see that we have increased the bystander CPR rate from 20% all the way up to 65, 67%. And a lot of it is being driven by the telephone instructions, okay? Now, there's also an increase in the baseline. That means people, before they call, they already start CPR. That's great. because they went for your CPR class, first aid class, etc. Right? So we need both. We need training the public and also telephone CPR. Okay, how many of you are on the My Responder app? Okay, if you are not, can I ask, take out your phone, go to your Android store or your Apple store, you just type My Responder, okay, free to download. Today we have 200,000 volunteers on My Responder, okay? In 20% of the time, before ambulance arrive, one of our volunteers is at scene for all cardiac arrests in Singapore, 20% of the time, okay? And they are starting chest compressions before ambulance arrive. And 10% of the time, they are putting the AED on the patient before the ambulance arrive. So that's fantastic progress. What is my ambition? I told you 200,000, right? My ambition is 1 million people on My Responder, 1 out of every 5 Singaporeans. Okay? So you just think of your family members. Most of you have at least 4 or 5 family members, right? Staying in your home. Yeah. How many of them are on My Responder? Okay? So let's try to build a nation of lifesavers. Okay, and then, today we have seen a lot of AEDs all on the, HDB, right? Every 2 blocks we have one. We have been proposing to MHA to say every block should have one, okay? And you might ask me, Marcus, how do you get money to buy all the AED? Okay, so when we started out, very simple, one word, gambling. We went to Tote Board and we asked them to, support us, and then that's how we actually funded it. Now, actually, the government has taken it up, okay? So whenever you buy your 4D, you are supporting our AED program. Okay, some more good news. So you can see that the number of survivors has actually increased. Like I said, we are having between 150 to 200 survivors a year. Now, there is one thing that is concerning. If you look at 2019, 2020, 2021, it has reached a plateau. And in fact, we had a drop. We had a drop in our bystander CPR rates. We had a drop in the number of successful resuscitation. And we had a drop in the number of survivors. Why is that? I think one factor is pandemic, right? So lockdown, right? Pandemic. So more people were having cardiac arrest at home rather than in the public. Lower chance of getting bystander CPR. Maybe with COVID and all that, more people scared to touch, a stranger, give mouth to mouth, or even apply CPR. Okay, so we are trying to get back to where we were before the pandemic. So again, I think this will need a lot of public education, encouragement of people, so that we can actually get back to where we were and actually improve further. And that has reflected, as you can see, ROSC stands for Return of Spontaneous Circulation. In other words, were we able to restart the heart, right? And that has actually plateaued or even dropped over the years. And the other factor that is going against us is aging population. So of course, with more elderly kind of arrest victims, the chance of successfully resuscitating them is actually declining. So in other words, if we do nothing, actually our results will get worse and worse, okay? It's just the nature of things, aging population. So we actually have to try harder, It's like you must study harder, then you can pass a PSLE, right? Okay, and so you can see we have done well over the last 10 years, but reaching a plateau and a recent dip because of pandemic. Okay, this is the one I promised. Survivor counts by electoral district. So if you are planning to move house or buy your HDB, you know where to go, huh? So every neighborhood is good neighborhood, right? But not all the neighborhood have the same number of survivors. Okay, what does this mean? This is something that you can go to your MP, to your local RC and all that and say, we need to do more community CPR training, or we need more AED in our district, okay? And at the hospital, this one is for my hospital colleagues. Again, every hospital is a good hospital, but not every hospital has the same outcomes for cardiac arrest. So again, the advanced treatments that we have, unfortunately, not all of the hospitals are actually so actively doing it. In fact, we've seen some decline in some of the treatments. Okay, so in summary, number of cardiac arrest cases going up, bystander CPR going up, bystander AED going up, very good telephone CPR going up, but in the last 3 years after pandemic, overall success in resuscitation going down, overall number of survivors going down, okay? And this is something that I think we need to work harder. Okay, linking this back to today's topic, right? Sports related is one of the big risk factors. So in fact, almost every marathon I can remember, we have had at least one cardiac arrest. And as you know, there have been deaths associated with it. And it's not just marathon, but mass events, mass sports events, etc. Okay? The good news is this is preventable, right? With good planning, with good screening, with first aid teams in place, right? And then having, you heard Dr. Yo talk about, the Japan model, having AEDs, first responders. Actually, you can get excellent, excellent results, okay? But I want to emphasize that it is not just for the professional marathons, right? Many of you run mass events, healthy walk, your school events, right? Sports day. Where is the AED? What is your response plan? What's your risk management plan when you're doing all these events? Sometimes there can be a few hundred people doing your events, right? And so I think these are the responsibilities that we have as the organizers, as the planners, as the responders to actually pay attention to. On the research front, we have been actually starting a long-term survivorship registry. So many of the survivors, we invite them actually to come and join our survivors club. We organize walks, cooking session, makan session with them, and we are following them up in terms of how to actually improve their rehabilitation and survival. Now, this device here is what I call the Cadbury chocolate bar. Okay, it's the next generation AED. There are a few different models in the market. This one, 300 grams, is about the size of a Cadbury chocolate bar, $200 US. Okay, unfortunately, it's not approved for sale in Singapore yet, but I'm trying to bring it in. And the plan is to equip the first 2,000 of our volunteer my responders with this device. Okay, yeah, so that we can issue it to them. It's your personal AED. You can bring it to work, bring it to school, put in your car, put in your office. Okay, put at home. All right, and then if you attend, you are activated for my responder. Bring it along, give the first shot. Okay, you can ask me, Marcus, how can I get one of these? Very easy. Sign up for my responder, and then be one of our top 10% responders. You will get this. Okay. Okay, some other interesting things. Dr. Benjamin Leong is here. He's our medical director for S995 dispatch. We have started in the last 1 year video dispatch. So in cases where it's not very clear, is the patient conscious? I don't know, I'm not sure. Are they breathing normally? I don't know. They will send you an SMS link, okay? Then all you need to do is click on the SMS, you will activate your phone camera. And then the SCDF dispatcher can see you, you can see them. You can use the front camera, the back camera. They will show you, they ask you, show me the victim. Right? Then they can see the face, they can see, are they breathing? And then they will tell you, this person is in cardiac arrest, please start CPR. Okay? So video technology is coming. We are using it more and more at 995, and we hope that this will help. Okay? We are also doing various clinical trials, bringing in a new drug that we call amiodarone. This has been successfully introduced to SCDF. We have brought in a device called the impedance threshold device. Again, it's helping with the airway. We are this year going to start cooling the victims who successfully restart the heart in the ambulance so that we can protect the brain. Okay, so look out for it. It's going to be a big trial that we're going to do. And then I talked to you about next generation AED. Okay, so this is part of a research program at Duke NUS where we are looking at community 995 ambulance hospital to improve outcomes. Okay, one advertisement is for our CPR card trial. So this is a credit card size device that actually gives you real-time feedback on the rate depth of compressions. Okay, and then the idea is that the generation 2 of the card actually links to your My Responder app. You will actually activate the camera so that you can talk to the dispatcher. And as you're doing compressions, they can tell you push harder, push faster. They can see the meter. Okay.
This tool, roughly the size of a credit card, can help resuscitate victims during a cardiac or breathing emergency. Called the CPR card, it's placed on a person's chest during CPR and then monitors the quality of the rescuer's compressions. It'll also alert rescuers if they're doing it deep and fast enough to keep the patient's blood flowing. Now, the aim is to help the public be more confident when performing CPR. Some 4,000 cards have been given out so far, and it's an initiative by the Health Ministry.
The other cool thing about this device is that it has a memory chip, and during a live use of the card, we will actually be able to feedback to the first responder to say, how well they were doing and whether there's any areas for improvement. So I think this is a wonderful tool. There's a lot of potential that will help us to improve the quality of CPR in the community. Yeah, so if you're asking me again, Marcus, how can I get one of those CPR cards? Answer is very easy. Sign up for My Responder. Okay, we are giving 15,000 of these cards out. 15,000 FOC. So the top 20% of the My Responder. Okay? Yeah, so it's the fighter pilot. Got 1 star, 2 star, 3 star. You hit 5 stars, sure can get one. Okay, so what is the long-term aim? The aim is to build a system that saves lives, where we can bring together man-machine mission, right? Our volunteers, like you, our professional responders, SCDF, emergency departments, but then equipping them with technology, right? And the necessary tools to save lives, and unifying them together with a common mission. So in conclusion, we do have challenges. The cardiac arrest is still a problem. It's increasing still, related to aging population. But there are solutions: improving community response, using technology, new clinical trials, improving rehabilitation for survivors, okay? And of course, data is something that will help us a lot, okay? And if we are thinking about the relationship between sports, okay, and heat, okay, so one of the things I do want to close and mention is that the combination of these two actually is an additional risk factor. So when we looked at, for example, this year's marathon, I think one of the factors has been that combination of exertion plus high heat, it actually is a higher risk for triggering cardiac events, like a abnormal heart rhythm or having a cardiac arrest. Okay, so this is the reality. This is the world we live in. It's going to be there for us to face, but as we have been trying to emphasize throughout this seminar, we can do things about it, right? From the risk perspective, from the management perspective, from the treatment perspective. And together we can work to save more lives. Thank you very much.